I'm so happy that the Mental Health Board adopted the resolution opposing the SFPD's bid to arm CIT officers with tasers. That is a huge victory. I hope also that a similar vote is taken in any other oversight body, such as Police Commission, that may hear this.
November 14, 2012, San Francisco's Mental Health Board passed a resolution discouraging the San Francisco Police Department from placing tasers in officers' hands to use against people undergoing psychiatric crisis in public. And public commenters voiced a negative opinion against taser use in San Francisco by the police.
Unbelievable to many San Franciscans if they actually even knew this was being considered. Most of them don't because the press doesn't cover it.
Elena Brooke began the proceedings by reading the resolution. The Mental Health Board urges the San Francisco Police Commission and San Francisco Police Department to oppose the adoption of electroshock weapons, tasers, for their SFPD CIT or Crisis Intervention Team officers.
The representative from the police?
Mikhail Ali, he's in charge of the de-escalation program.
To support his point, he was using an example of a person that came charging with a knife, and actually apparently he was inappropriately using that point because the person involved had asked him specifically not to use that example.
The person involved with police shot him dead. His family asked that he not use this young man as an example.
Just the logic of it strikes me. There must be all kinds of procedures in the police for people coming charging you with a knife. I mean, why do there need to be special procedures for mental health patients? Your ordinary person charging you with a knife. It's not different. Using this in support of tasing mental health patients is apples and oranges and complete nonsense.
The proposed change in the SFP's use force governing policies to permit the issuance of tasers to CIT-trained officers is contrary to the goals and directives governing CIT in both form and substance.
The police have caged this particular go-around of trying to acquire tasers. They're saying that they want to specifically arm the CIT-trained police officers with tasers. CIT is supposed to be a tool to de-escalate situations of mental health crisis. To only arm folks that are specifically trained to work with people with mental illness and in mental health crisis with tasers is a significant policy problem.
In a volatile situation, the important thing is to diffuse and de-escalate. It would be way too easy to commit grievous harm towards a helpless and probably agitated person who's not really dangerous, suffering and needs help.
I'm a community activist with a 5-year history as a mental health worker. Anyone who has any kind of mental health training or background has been trained in the art of being in crisis with someone, matching them at their level of anxiety and trying to de-escalate that and bring that down.
In the future, you may be listening to radio or watching television and hear that someone in the San Francisco Police Department accidentally shot someone with a taser.
James Clifton Barnes, 37, March 19, 2012. Struggling but in handcuffs, tasered by Marine Deputy Kenneth Kubler. Died a few days later. Ray Williams, September 11, 2009, double amputee, legs and arms. Tasered while having 3 police on him. January 1st, 2009, Oscar Grant, an unarmed young black man shot by a lethal weapon.
The California study showed the rate of sudden in-custody deaths increasing 6.4 times and the rate of firearm deaths increasing 2.3 times in the first full year of taser deployment with no corresponding change in officer injury or death.
755 people dead in the United States since 1983. 170 in California.
In October, there was a report about police tasing a blind man. They mistook his white cane for a samurai sword.
Police violence is a very serious form of violence, often racist, paranoid, without any provocation. They need their deadly weapons taken away from them instead of adding deadly weapons to their armory.
The officer was swearing at me to relax, saying that he would beat me up if I didn't. If he had a taser, he would have used it. I am a veteran with post-traumatic syndrome. I get nervous,
Risk of taser injuries and or death is heightened for the mentally and emotionally ill who in a crisis may be potentially unable to connect actions to consequences and may resist police even in the face of stepped-up force.
My son, he was bipolar, was shot 48 times by SFPD. He would not have been shot to death. He would have been zapped to death.
The Bakersfield Police Department beat my son. At least he didn't get electrical shock.
We do not want SFPD to be harmed with torture devices.
Tasers clearly are lethal for many of us. Those who are in custody.
People in states of acute agitation resulting from mental illness have been associated with unexplained deaths in custody.
Those who have acute agitation from their emotional distress.
Research has found patients taking prescribed antipsychotic medications are already at increased risk of sudden cardiac death if tasered. American Civil Liberties Union has raised concerns about their use, as has the British human rights organization Resist Cardiac Arrest.
In 2001, Mental Health Board Executive Director Helena Brooks, introducing Mental Health Outreach Director Mary Kate Connor, and retired SFPD Lieutenant Michael Sullivan created this CIT training, modeled after the successful Memphis training. They have no tasers. Memphis has had a successful program. No fatalities.
The Memphis, Tennessee Police Department CIT curriculum has been used to inform and create the SFPD curriculum since May 2001. In 2011, Memphis, Tennessee PD consulted to SFPD. Memphis still refuses to use tasers as they have confidence in their CIT training for de-escalation without the use of tasers.
I've worked in mental health settings and crisis settings in 5 states over 20 years. I've been in the presence of people homicidal with weapons. You don't need weapons, even in the most dire circumstances.
It was directed by the Board of Supervisors in a unanimous vote that 25% of the police force would be trained every fiscal year starting in 2002.
Both the Mental Health Association and NAMI San Francisco have been working with the police department to implement a new CIT crisis intervention team model. We've been working to develop the curriculum, participate and coordinate the trainings, and consult with the department and others in the development of the CIT program.
Only 74 officers have been trained. Even though there's been a very strong commitment by the Board of Supervisors and the Police Commission over 2 or 3 times where this issue's come up.
Disproportionate use of tasers against minorities has been well documented by the ACLU.
Across the nation, approximately 301% disproportionate use against African Americans, and in California, the highest group that have been victims of taser-related deaths at a tune of 45% is Latinos. The most likely victims of death at the hands of taser are autistic children, seniors, homeless people, people with metabolic disorders.
I'm subject to hypoglycemic seizures. During the pre-seizure activity, I may yell, curse, fall, appear combative, erratic, or disoriented. So I'm a prime candidate for tasering.
Disabled people, epileptic people,
people suffering from autism,
people high on drugs or alcohol. 20% of taser-related deaths in the U.S. are people with mental health conditions. As a formerly epileptic black man that has dealt with various mental health issues, I pray that you continue to push against this. This can save lives.
The cost of tasers is prohibitive, costing about $1,000 per unit, including holster and cartridges, plus the cost of equipping each squad car with the necessary defibrillators at triple the cost of a taser, plus hospital visits for subsequent injuries, and possibly litigation costs, which have already saddled California taxpayers with over $10 million since 2009.
The high cost of providing officers with tasers could be applied to offering de-escalation training for more officers and peer-led social inclusion training for more officers as part of the CIT.
We would propose a ride-along program or a joint response program in which the police are not put into the front of situations that involve people in psychiatric crisis.
The Mental Health Board urges the San Francisco Police Commission and the SFPD to oppose the adoption of tasers to SFPD CIT trained officers. Laura Alguelles, Tara Chien,
Yay.
Wendy James,
Yay.
Ellis Joseph,
Yes.
Lisa Landy,
Yes.
David Lewis,
Yes.
Virginia Lewis,
Yes.
Lena Miller,
Yes.
Terrace Patterson,
No.
Alphonse Vin,
Yes.
Darrell Wisham? No. 9 yeses, 2 noes. The motion passes.
Yes.